Hello everyone, I'm Dr. Monica. In today's video, we will be discussing the guidelines provided by the British Society of Periodontology to apply the 2017 classification of periodontal and peri-implant diseases and conditions clinically. So let's understand step by step how to clinically diagnose the periodontal disease. So whenever the patient comes into the clinic, first we begin with the medical history taking. So in this, the patient will be asked the family history of periodontitis, if the patient is diabetic or not, and will also inquire about the smoking status of the patient and if the patient is using any other medications or not. Because these factors, they will influence the grading during the diagnosis. Next is the clinical examination. In this, we evaluate the gingival color, the contour, we check for any kind of swelling present or any enlargement. We look for the presence of plaque or calculus and we check for gingival recession and also the tooth mobility and suppuration. So after the clinical examination, periodontal disease is screened using the basic periodontal examination. And in this BPE, we use a WHO probe with a 0.5 mm ball tip and a black band between the 3.5 to 5.5 mm. So this in this PPE, the whole mouth it is going to be divided into 6 sections, and we record the highest score in each section. So from code 0 to 2, in this what happens is the black band it remains completely visible, and in code 3 the black band it will be partially visible, and in code 4 the black band it is not visible, which indicates a pocket depth which will be greater than 6 mm. So in cases of BPE code 0 to 2 clinically, where there is no evidence of interdental recession, the case can be classified as either periodontal health or gingivitis. Whenever the bleeding on probing it is less than 10% of the total sites, this case will fall under the clinical gingival health. And when the bleeding on probing it is between 10 to 30%, this case will fall under the localized gingivitis. And when bleeding on probing it is greater than 30%, this case is of generalized gingivitis. So in case of BPE code 3, where there is no evidence of interdental recession, we perform appropriate radiographic assessment, which is followed by initial periodontal therapy. Then we re-evaluate the case at 3 months and then record the 6-point pocket depth in the affected sections. So after this, we have two scenarios. The first one, if there is no periodontal pockets greater than 4 mm, and if there is no radiographic sign of bone loss associated with periodontitis, then we proceed with the code 0 to 2 pathway. In the second scenario, if the remaining pocket it is greater than 4 mm, and if there is radiographic signs of periodontitis related bone loss, then we proceed with the code 4 pathway. So coming to BPE code 4, in this we can see that there is clinical evidence of interdental recession. In this we perform appropriate radiographic assessment followed by full periodontal charting to confirm the clinical attachment loss and radiographic bone loss. Based on the sites involved, we have three patterns. The first pattern is molar-incisor pattern. In this, the bone loss it is predominantly seen around the first molars and incisors. So this is periodontitis molar-incisor pattern. Then we have localized periodontitis. In this, the teeth involved it is less than 30%. Then there is case of generalized periodontitis. In this, the teeth involved it is greater than 30% of the teeth. So after this, staging and grading is done, and we find out the current disease status and the risk factor assessment is done. So let's talk about staging and grading of periodontitis. For this, we use available radiographic evidence such as periapical radiograph or OPG or DPT. And if only bite wing is available, we use the clinical attachment loss or bone loss from cemento-enamel junction. So staging of periodontitis, it tells us about the severity of periodontitis. So staging, it is determined by the interproximal bone loss. In this, we record the site with worst bone loss caused by periodontitis. So we have four stages of periodontitis. First stage, that is the initial. In this we can see that there is less than 15% of bone loss, or there is less than 2 mm of attachment loss from the cemento-enamel junction. So next stage 2, it is the moderate periodontitis. In this we can see that bone loss, it is seen in the coronal third of the root. Coming to stage 3, that is severe periodontitis. In this, bone loss, it is present in the mid third of the root. So stage 4, which is advanced periodontitis, in this the bone loss is seen in the apical third of the root. So let's talk about the grading of periodontitis. So grading, it tells us about how fast the periodontitis it is progressing. So it is calculated by the percentage of bone loss by the patient's age. So in this also we record the site with the worst bone loss caused by periodontitis. So in grading we have three grades. So the first one, that is the grade A, it is slow rate of progression. In this, the ratio of bone loss to patient age, it is less than 0.5. And in grade B, which is moderate rate of progression, it is 0.5 to 1. And in grade C, that is rapid rate of progression, the ratio is greater than 1. So coming to the assessment of current periodontal status, in this we have three categories. The first one, it is currently stable case. In this we can see that the bleeding on probing, it is less than 10%. The probing pocket depth, it is less than 4 mm, and we can see that there is no bleeding on probing present at 4 mm sides. Next case, it is currently in remission status. So in this we can see that the bleeding on probing, it will be greater than 10%. Probing pocket depth, it is less than 4 mm, and also in this we can see that there is no bleeding on probing at the 4 mm sites. The third state, it is the currently unstable state. In this, the probing pocket depth, it is greater than 5 mm, or the probing pocket depth greater than 4 mm, and where there is presence of bleeding on probing. So talking about the risk factor assessment, we look for two things. First one is smoking, that is the number of cigarettes smoked per day, and also the suboptimally controlled diabetes, that is the level of HbA1c. So let's understand how do we state the diagnosis of periodontitis. So first we have to mention the extent, followed by periodontitis, then staging of periodontitis, followed by grading, and then the status of periodontium, followed by risk factors. Here is an example of the diagnosis statement of periodontitis. So if you have found this video useful, please like, share and subscribe to this channel. Thank you.